So hi friends, welcome back to my channel. Today we are going to discuss about a child health nursing topic, that is hydrocephalus. Okay, from the name itself we know that hydrocephalus is an accumulation of fluid in the brain or brain, and it causes enlargement of the brain, okay, or head, that is hydrocephalus simply. So moving to introduction, it is developed from two Greek words, that is hydro means water and cephalus means head, and it is an accumulation of excessive fluid in the brain. That is simply introduction of hydrocephalus. It is head is looking like this. Okay. So before going to the topic, we have to study about CSF. CSF is normal CSF level is 150 ml. Okay, it is asking in every questions. Okay, like PSC, AIMS, etc. Then CSF is formed by choroid plexus, then absorbed by arachnoid villi, and normal production of CSF is 500 ml, and it is reabsorbed daily. Okay, as much amount is reabsorbed. That is about the CSF. And next we have to study about the normal CSF circulation. Before going to study the circulation, we have to study about the brain ventricles. See, there is a four ventricles for brain, two lateral ventricles. These are two lateral ventricles, and it is connected to the third ventricle, and it is connected to the fourth ventricle. It is under it continues as spinal cord. Okay. See, these two lateral ventricles is connected to the third ventricle by foramen Monroe. Okay. And this third ventricle is connected to fourth ventricle by aqueductus sylvius or cerebri. Okay, aqueductus cerebri or aqueductus sylvius. And this fourth ventricle is connected to cerebrospinal cord or subarachnoid space by foramen Leschka. Okay, foramen Leschka by subarachnoid. Fourth ventricle to subarachnoid space by foramen Leschka. Okay, and CSF is reabsorbed in the venous sinus by arachnoid villi. Okay, it is once it is entering into the systemic circulation and it is reabsorbed by the arachnoid villi. Okay, and it is returning and repeating the process. That is normal CSF in the 150 ml is a normal CSF production. Okay. Next, moving to the definition. Hydrocephalus is defined as an imbalance between production and absorption of cerebrospinal fluid, that is CSF. Okay, there is an imbalance between production and reabsorption or production and absorption. Okay, that is simply hydrocephalus, and it is characterized by abnormal increase in the volume of CSF. Okay, abnormal increase in the volume of CSF within the intracranial cavity. Okay, intracranial cavity resulting in the enlargement of infant's head. Most probably it is occurring in the infants under 1 year of age. Okay, so it is characterized by increase in the volume of CSF, and that will increase the intracranial cavity pressure, and it is cause enlargement of the infant head. That is simply hydrocephalus. Then incidence. Moving to the incidence, 1 to 3 of every 1,000 born children is affected by hydrocephalus. Okay, 1 to 3 of every 1,000 born, and it is a pie diagram showing that age group. Okay, most probably it is affecting after under 1 year or 12 months. Okay, under 12 months of age, and out of this red mark is 1 to 6 months is more prone. Okay, then this blue is 0 to 28 days, and later 7 to 12 months, and 1 to 6 years, and 6 to 13 years, most probably under 12 months. Okay. Then moving to the risk factors. What are the risk factors? First one, lack of prenatal care. Prenatal care means during the time of pregnancy, lack of prenatal care. Then multiparous gestation, that is number of fetus will be increased. Okay, 2 or 3. Then maternal diabetes, then chronic hypertension, then maternal hypertension during pregnancy, alcohol using during pregnancy, maternal obesity, then gestational diabetes. These are the risk factors. So before going to the next topic, we have to discuss about a small topic, that is spina bifida. Okay, what is spina bifida? See, when there is an abnormality in the development of spine, that is backbone of the fetus. Okay, sometimes there will be abnormality in this development of backbone, so there will be a gap in this area. So okay, backbone will not be continuous. So the spina bifida is divided into three types. That is one. First one is spina bifida occulta. Next one meningocele, and next one myelomeningocele. Okay. In the spina bifida occulta, there will be a gap in the portion. Okay, in the spine. So there is no protrusion of spinal cord. Okay, only gap. And in case of meningocele, there is a sac is pushes outward through the spine. Okay, a sac is pushes outward through the spine, that is meningocele. This is not as much as severe, but in case of myelomeningocele, it is most severe because Some nerves also coming out through the gaps. Okay, spine sac as well as the sac as well as some nerves are also coming through the spine. Okay, spine gap. As a result, there is a compression is occur and there is a marked pain will be baby have experiencing a marked pain and other the nerve supplies distant to that will be disrupted. Okay, these are spina bifida. This is simply spina bifida. Okay, you have to understand. And the next one is a Dandy Walker malformation. What is Dandy Walker malformation? Okay, simply there is a decrease in the brain development. Okay, so this cerebellar size will be decreased so that the normal brain will be like this, and the in Dandy-Walker malformation it is the cerebellum will be decrease in size and it will be by this portion only. Okay, and the both the hemisphere will be in different size. Okay, and development and growth and development and other skills will be reduced. See, Dandy Walker means these are identified by two scientists, Dandy and Walker. That is why it is known as Dandy Walker malformation. Okay. So next we can move to the etiological factors. See, hydrocephalus are of two types. First, congenital hydrocephalus and acquired hydrocephalus. In etiology is classified according to that only. First one, etiology for congenital hydrocephalus. First one is Arnold-Chiari malformation. Okay. So in this, displacement of brainstem and cerebellum through foramen magnum. Okay, displacement of brainstem and cerebellum. So foramen magnum means there is a opening in the base of the skull. That is foramen magnum. Okay, this is the foramen magnum. So there will be a displacement of the brainstem and the cerebellum, and it is occurring in the. See, this is the Chiari formation is occurring in the cervical portion. Okay, upper cervical part of the spine, and spina bifida in the lower spines. Okay, and it is generally associated with the spina bifida and meningeus myelocele. Okay, this is Arnold-Chiari malformation. Sorry. Next one, Dandy-Walker anomaly. I already discussed that, in which the congenital septa or membrane block outlet of the fourth ventricle will be blocked. Okay, so that is Dandy-Walker anomaly. Next one is malformation or stenotic lesion of aqueduct cerebri. That is third to fourth ventricle connection. Next one, malformation of arachnoid villi. Okay. Next, we can see the etiology factors for acquired hydrocephalus. First one is inflammatory. Inflammatory, most probably meningitis. Okay, meningitis and sometimes encephalitis. Meningitis means inflammation of meninges. Okay, then second one is traumatic. Traumatic may be birth trauma. Then head injuries will be there. Intracranial hemorrhage will be there. These are coming under traumatic. Next one, neoplastic. Neoplastic means space occupying lesions that are such as tumor. Okay. Next one is chemical. Then hypervitaminosis A. In that hypervitaminosis A. Then next one is connective tissue disorder such as achondroplasia. Achondroplasia means, see, this is a picture. Sometimes dwarfism, somewhat like dwarfism. There is an improper protein development or protein management in the body, and it will cause the brain development. That will cause dwarfism. That is achondroplasia. Next one, move to the types of hydrocephalus. First classification is congenital and acquired hydrocephalus. Okay, congenital and acquired. In congenital, there will be occur at the birth and become apparent at the first few months of life itself. The patient, the baby will show the symptoms. And next one is acquired hydrocephalus. As a result of causative factor, it will develop later. Okay. Next type is depending upon the site of obstruction. Okay, it is classified into depending upon the site of obstruction. Hydrocephalus is classified into first one is communicating hydrocephalus. Okay, in communicating hydrocephalus, there will not be any blockage in the ventricular system. Okay, ventricles is connecting properly. Okay, so there is communicating in the ventricles are communicating. So that is communicating hydrocephalus, and this blockage in the basal subarachnoid and arachnoid villi. Okay, arachnoid and basal subarachnoid sulci. So these are. Then next one is meningitis is most common cause of communicating hydrocephalus. Okay, meningitis is the most common cause. Next one is non-communicating hydrocephalus. From the name itself, there will be pathway. So ventricular pathway, CSF block, the CSF flowing pathway, there will be a blockage, that is non-communicating pathway. And It is from proximal to the outlet of foramina of fourth ventricle, cause usually congenital. Okay, from the proximal portion to the outlet of the foramen, there will be any place there will be a blockage, and that will cause a non-communicating hydrocephalus, and usually it is a congenital one. Next one, arrested hydrocephalus. Okay, arrested hydrocephalus means it is occur both the congenital and acquired hydrocephalus may undergo spontaneous arrest, but it is not a serious one. Okay, it does not require active surgical intervention. Okay, that is arrested hydrocephalus. Next, we can move to the pathophysiology. What is the pathophysiology? First one is ventricular system becomes distended and dilated due to the increased CSF level. Okay. Next, increased ventricular pressure will be occur. Thinning of cerebral cortex and cranial bones will be occur. Thinning of cerebral cortex and cranial bones. As a result, the ependymal lining of the ventricles are disrupted. So oozing will be there. Okay, once there is a thinning occur, there will be oozing will be there. And it will cause subependymal edema occurs and white matter is compressed. Okay, inner white matter and outer grey matter. Okay, once there is an enlargement of the ventricle and it will compress the white matter. Okay, so outward bulging of the third ventricles occur, and this outward bulging causes compression of the optic nerves and hypophysis cerebrae, that is pituitary gland. Okay, hypophysis cerebrae and optic nerves will be compressed, and dilation of cellular torsicle. Okay, cellular torsicle means small groove for pituitary gland, that is cellular torsicle, that will be dilated. And the choroid plexus is usually atrophied to some degrees, and a cortical atrophy may also occur. This is the pathology. Next, we can see the clinical manifestation. First one is for infants. What are the clinical manifestation for infants? The common signs which include changes in the head, that is enlarged head, unusually large head, and a rapid increase in the size of the head, and a bulging or tense soft spot, that is fontanella will be soft on the top of the head. Okay. And one important thing is Mach1 sign. It is asking for every questions. Okay, that is for objective type questions. Mach1 sign, that is when doing percussion in the hydrocephalus baby's head, there will be a cracked port sound will be there. Okay, that is Mach1 sign. Next, continuing the physical signs and symptoms: vomiting, sleepiness, irritability, poor feeding, seizures. Then sensitize. It's also important. Eyes fixed downward, because there will be a optic nerve compression, and there will be edema in the eyelids. Okay, so there will be a sunsetting eyes, or eyes fixed downward. Then deficit in muscle tone and strength, poor responsiveness to touch, and poor growth. Next one, clinical manifestation for toddlers and older children. First one is headache. Okay, headache, then double vision, then sunset eyes, then abnormal enlargement of toddler's head, sleepiness or lethargy, then nausea, vomiting, unstable balance, then poor coordination, poor appetite, poor seizures, urinary incontinence. Okay. Next, behavioral and cognitive changes. Okay, sometimes I will be asked the clinical manifestations of hydrocephalus. So there will be 5 marks. So we have to enter all the things. Okay, that's why I am telling you detailing. Behavioral and cognitive changes such as irritability, change in personality, decline in school performance, delays or problems with the previously acquired skills such as walking or talking. Young and middle-aged adults. In case of young and middle-aged adults, common signs and symptoms includes headache, lethargy, loss of coordination or balance, and loss of bladder control, and urge to urinate, impaired vision, decline in memory, concentration and other thinking, and affecting the job performance. These are the clinical. See, in case of older adults, that is above 60 years, there will be a loss of bladder control, okay, or frequent urge to urinate. Then memory loss will be there, and reasoning and thinking skills will be decreased, and difficulty in walking, shuffling gait will be there. Poor coordination or balance will be there for older adults. Next, we see the diagnostic findings. What are the diagnostic findings? First one, history collection, and in this, there will be pregnancy, maternity. From the maternity also we have to collect the details. Okay, then physical examination, basically head. Okay, head and circumference will be assessed, and fontanelles will be measured. Okay, assessed. Then blood investigation, then X-ray, MRI, CT, USG, CSF studies. Okay, these are the diagnostic studies. Next, medical management. Proper medical management is carbonic anhydrase inhibitors. Okay, carbonic anhydrase inhibitors like acetazolamide or Diamox is dose of 50 mg per kg per day to reduce CSF production in slow progressive hydrocephalus. Okay, and oral glycerol and isosorbate is also used to reduce the CSF production. Next, we can move to the surgical management. Okay, surgical management is indicated for obstructive hydrocephalus. Okay, in case of rapid enlargement of head, visual disturbance, and life-threatening increased ICP, we move to the surgical management. Okay. Then ventriculostomy and choroid plexectomy have performed with the variable results. Okay. According to severity, we are doing the surgical surgeries. Okay. Then surgical shunts are treatment of choice at the present time. Okay. Then intracranial or extracranial shunt is doing to bypass the obstruction or to decrease the CSF pressure. Okay. Shunting will be there. Okay. I will tell you detailing. See, most commonly performed extracranial shunt is ventriculoperitoneal shunt, VP shunt. Okay, in this shunting is done from the CSF is shunting to the peritoneal cavity. Okay, this is VP shunt. Okay, then this is VA shunt, ventricular arterial shunt, atrial shunt. Okay, ventricular atrial shunt, atrial cavity shunting to the atrium. Then other approaches are ventricular atrial shunt, ventricular pleural shunt or ventricular gallbladder shunt. Most probably we are using VP shunt. It is very much which will when the babies in a VP shunt we have to monitor thoroughly. Okay, continuous monitoring there is need because chance of complication is very high. So what are the complications? First one seizures, then herniation of the brain will be there. Then spontaneous arrest due to natural compensatory mechanism, persistent increased ICP and brain herniation. So spontaneous arrest. Then developmental delays will be there. Then depression in the adolescent is common. Okay, these are the complications. So move to the nursing management for infant. We have to assess the head circumference continuously. Okay, there will be marked changes day by day. Then palpate the fontanelles. Then pupillary response we have to check and assess the level of consciousness. Then breathing patterns have to check and feeding patterns have to check. Motor activity and development skills will be assessed. And regarding older child, measure the vital signs and assess the patterns of head and emesis. Then determine pupillary response, level of consciousness, motor function to be assessed, milestones to be assessed, school performance to be assessed, and obtain parent report or of recent behaviors. These are coming under nursing assessment. Then move to the nursing diagnosis. The foremost one is impaired cerebral tissue perfusion related to increased ICP. Next one, impaired nutritional status less than body requirement related to reduced oral intake and vomiting. Next one, risk for impaired skin integrity, it is important, related to larger head. Then anxiety related to abnormal condition and surgical intervention. Then risk for infection related to introduction of infecting organisms through the shunt. Okay. Risk for fluid deficit related to CSF drainage. Then ineffective family coping related to life-threatening problem of infant. Okay, these are coming under nursing diagnosis. So till now we are discussing about the hydrocephalus, etiology, types, and management. So hope you are interested. Thank you.